Hello viewer, hujambo. Welcome to this GTN Nursing Services, where I, Grace the nurse, talks about mother and child health care. We are on a running series whereby we are talking about children who are in the adolescent stage. So we called this one a teens clinic. This is because from the time I started this YouTube channel, the children who are born then are now entering their teen age. We already started our running series whereby we are covering the topic on growth spurt. We covered part A, whereby we saw the expected outcome of children at this threshold period. The expected outcome were 3. We covered the first outcome, whereby we saw that maturation of some body structures and their function causes the physical changes in a child, whether a boy child or a girl child. So today we are going to talk about the second expected outcome, that is emotional maturity. And the emotional maturity is where the child learns how to communicate with others, solve problems, and make decisions. So, welcome. What is our learning objective? Our learning objective is that by the end of this learning session, the viewer should be able to explore the emotional status of an adolescent. By the time we finish this learning session, the viewer should be able to explore the emotional status of an adolescent child. Why? Because we are told that emotional independence or maturity develops gradually throughout adolescent years. The other one we covered, we were told that the expected outcome of maturation of the body structure and their function takes between 2 to 5 years. But for the emotional independence or emotional maturity develops gradually throughout the adolescent years. Emotions are responses of mind and body to a stimuli. Yes, emotions are responses of mind and body to a stimuli. And a stimuli can be what? A stimuli can be anything that a child sees with her eyes, something she hears with her ears, something that one gets through smelling, something somebody gets through tasting. How many ways? 5. Seeing, hearing, smelling, tasting, and through the skin, the touch. And therefore, we are told that one is said to be emotionally mature when he or she learns to depend less on parents for emotional needs. Yes? If you can remember your baby when he or she was small, there was a state they used to fall called the tantrum. Children used to throw tantrums when they are in need of something. Have you ever experienced this? You go to a supermarket with your kid, and then the kid starts demanding 1, 2, 3, and then if you say no, the child starts yelling in front of everybody. Yes, that is what we call throwing temper tantrums. But now here we are told that when a child reaches adolescent, one is said to be emotionally mature when he or she learns to depend less on parents for emotional needs. Then we are told that adolescents are between 2 stages. Sometimes they are capable of mature actions, and the other times they fall back on child response patterns of emotions. Yes? Very strange that adolescents are between 2 stages, and sometimes they are capable of mature actions, and the other times they fall back on child response pattern of emotions. Let us see some cards here. And when we said that you should be able to explore the emotional status of an adolescent is after a child gets stimulated, either through the sight, through the hearing, through the smelling, through the taste buds, or through the skin, what kind of emotion is this child going to show? And you as a parent, how are you going to interpret it? You can interpret it as silly or scared. One can be interpreted as shy or surprised. Another emotion can be interpreted as happy or sad. And another emotion can be interpreted as angry or tired. So, as a parent, when do you interpret all these emotions? This is because we are told different facial expressions communicate different emotions or feelings. Yes? So when you get any one of these emotions on your child's facial expression, it means that this child is expressing some feelings. So as a parent, how are you going to interpret that? As simple as that. On maturity of emotions, learning how to communicate with others, solve problems, and make decisions. This one, as a parent, it is you to be able to monitor and explore, so that you'll be able to interpret whether this child of yours is communicating something, this child is trying to solve a problem, or this child is trying to make some decisions. Okay? Thank you. Hope it is clear. But we said that parenting is not passed in a silver plate. Every parent experiences parenting differently. So it is one to handle the situation the way it is. This is from Grace the Nurse of GTN Nursing Services. Like it, share it, subscribe, and register for this class. Thank you. See you in the next clip.